The following video is to help train staff in Tees Esquire Valley's NHS Foundation Trust in the importance of PROMs and specifically SWEMWBS and how they can be used correctly in clinical practice. I'm Adam Tivernan, not only a service user within TUV, but also a member of their Experts by Experience group. I want to show how important SWEMWBS, which stand for the Short Warwick Edinburgh Mental Wellbeing Scale, how important they can be for us the service user and use the clinician in building that all-important relationship, which is vital in helping us on our recovery journey. SWEMWBS are used to monitor our well-being from our perspective and what impact, if any, interventions have had. We need to move away from this just being a ticky box exercise. If you don't believe in the importance of this paperwork, then how can we believe in the importance of it? Another really important part of the SWEMWBS is enabling us, as service users and yourselves, to plan our care together, which is vitally important going forward in our recovery journey. We need to be validated, we need to be listened to, and this is one of the steps that can be taken to help us achieve that together. We need to look towards the recovery goals of CHIME: connectedness, hope, identity, meaning and empowerment. And with this form being completed correctly and filled in together, that is very possible. It is your responsibility as staff members to ask us how often we would like to complete the SWEMWBS form, be it as frequently as we would like, or every time we come in for meetings and reviews. It is vitally important that you ask us whether we need help or assistance to complete the forms, or whether or not we are able and more than willing to complete it ourselves. We need to work together throughout this process and to find out and to achieve what is best for the service user. The following film is not a depiction of anybody's personal stories or personal experiences. It is purely made up for the purposes of training.
The following video is a review meeting between a care coordinator and the service user. The SWEMWBS has been completed prior to the review and the data printed to be shared with the service user to review progress.
Hi Mary, thanks for coming today. Today's opportunity for us to review the care that you've been receiving for about the last 6 months now. Yeah. Thank you for completing this before today. It's given me opportunity to have a look at how things have been progressing and how well it looks to me like you've been doing. Does it feel to you as if things have improved?
It's been a lot of changes, yeah.
Great, because I can see from here where you were scoring really low and feeling quite low, flat, preoccupied, not being able to think clearly 6 months ago. We're now up to being able to cope with problems well, deal with other people, feeling close to others. It looks like you've done really well.
Yeah, it's good to see actually that.
Yeah, so this graph helps you see and track your progress. Mm-hmm. And an increase is obviously an increase in your well-being.
Yeah, that's great. Yeah.
Is that nice to see?
It is actually, it is good. I mean, I'm coming here feeling a lot more contented than I was last time, and it's good to see. Yeah, it's good to see that. Yeah, especially and when I see the difference.
The information gathered so far would help inform Honors Item 7. Further information would determine whether this score should be 1 or 2.
Would it help if I summarised where I think we were 6 months ago? Yeah. So when you originally came, you were really suffering, you were off work sick, your relationship with mum and your friends had broken down. You were experiencing 2 voices in your head, Grandad and a female, and Grandad was being really critical. You also found that quite reassuring, so you didn't necessarily want that voice to go altogether. But you were just so isolated, you weren't dealing with problems well, you weren't coping very well, you were anxious all of the time. I can see from your ratings now, things have improved. Yeah,
it's nice to see. I mean, like looking at that scale, I do feel more positive. It's nice to see. It's kind of like evidence of it, so it's cool.
Yeah. Sort of hits you in the face, doesn't it, when you see it like that? Yeah. So instead of me going through it in a linear fashion, do you want to tell me how things have been?
I think the one I was finding a lot of difficulty with was the concentration levels and not being bothered by stuff, and also my interaction with people, you know, like my family, and not wanting to be around people, and there's been lots of changes there. I see my mum like more, and it's better when I see her.
Great. So, in terms of feeling close to people, we've still sort of rated ourselves as rarely.
Yeah.
So you've said you're seeing mum a little bit.
Yeah.
We're not back to where we were before then,
No,
that's still
not
an
that.
area.
Yeah, but I think it's just because, you know, I'm trying to, well, I'm giving it a go with work, because I was off sick, and I've been in to talk to them, and I'm going to sort of like wean myself back on into work with them. So I'm sort of concentrating on doing that, and I've been offered the chance to go to recovery college, and there's things on there which might help me with skills towards, you know, with that, and then helping myself, and with the voices I was hearing. I was being put in touch with the Hearing Voices group, which is great because there's people who have similar things to myself, and it's been good to get their sort of, not as much help, but like I don't feel like it's just me, because I used to wonder if everyone and yeah, it's helpful. So, and I've made like some friends there, which is nice, because it's not that I don't want to see my old friends, but sometimes it's hard to explain to people, and these people I'm meeting who can empathise, and because I don't kind of have to explain myself, so it just makes
people who've experienced similar things,
yeah.
It can be much more empathetic, can't they, than people who
Yeah.
haven't experienced that. So what type of impact has that had on your life then in general?
It's just, I mean, apart from the fact that the voices aren't as intrusive, you know what I mean, but I feel more confident. I'm actually going out, whereas I wasn't before. I wasn't actually really wanting to. I was, I'd rather just stay, you know, I didn't want to put myself in any positions where I'd find it difficult, or that something would happen when I was out. So, yeah, I just avoided it, whereas now I'm giving it a go.
Excellent.
And I want to, you know, which is nice.
Yeah. And what is it that we've done to help with that?
I just kind of, well, I was on like a different medication for the depression, but it was suggested to try an antipsychotic, which I've given a go, and it's only early days with it, you know, just to see if that can help at all, as well as the other skills, because obviously that's not, you know, I don't want that just to be the thing, but
So medication's helping?
Yeah. I mean, I'm not.
The information discussed so far would help inform Honors Item 6. Mary has said the voices are less intrusive and troubling. Mary has described improved relationships and an ability to make new friends. This information will help inform Honors Item 9.
So Mary, you've told me that things with mum has improved, and that you've met some friends via the Hearing Voices group that you've been going to. What type of work have you been doing with the support worker, with Andrew?
He's introduced me. He's been like taking me out, like we went out for coffee and things like that. But he was also helping with the recovery college, you know, to find out about that. And it's just sort of getting out and being able to do that. So he's been going with me and accompanying me. So just because when I used to go out and it would be distressing and I'd panic. So when he's just like sort of enabling me just for a while to have someone there, and then I get more used to it, and the fact that if something does happen, it's not like the end of the world, and it's not gonna, no one, you know, and I can cope with it.
Great. So it sounds like you've been feeling more relaxed then as well. So it sounds like some of the work that Andrew's done's help calm you when you're out of the house. Is that right?
Yeah.
Great.
Because if he's there, then you can like reassure me, or you can sort of say, this, you know, what's happening, and we go through it there and then.
The information gathered could help inform Honors Item 8 and also Honors Item 12.
Okay. And they've been thinking clearly that that's moved from being none of the time to some of the time.
Yeah.
So is that to do with the reduction in the voices? Yeah.
I think it's the fact that, I mean, they're still there, but I'm coping better because I can sort of say not like talking to them, but I can sort of say, well, you know, I kind of guess, you know, get what you're saying, and they don't seem, I mean, the granddad's not as I don't know whether it's because I'm feeling differently, but it's just they're more positive.
Okay.
It's not as you know, hurtful.
Right, because he was being really critical,
Yeah.
wasn't he, at one point? Yeah.
Yeah, and that was making it difficult because it's like constant, you know, and it's not constant.
Right, that's really good. That's good. That's good. Your optimism for the future's also improved. So is that just been a combination of everything that you've just
I
described?
think so, yeah, definitely. I can't really pinpoint one thing to say that's helped, but yeah, it's been a lot of things. And,
Okay.
you know, I feel definitely. I mean, something I mentioned, like recovery. I do feel like you know, it's a constant journey, but yeah, I definitely feel in a different place to when I first came to see you.
That's great.
Which is, yeah, and looking at, it's really good to see.
And we're heading in the right direction then.
Yeah. And I think because sometimes you obviously have that worry that, you know, you don't want to get too excited when you feel more capable maybe of sort of things, but at the same time, yeah, I do want to enjoy it while I can in case, but these things are helping me prepare for.
So you sound there as if you're a little bit apprehensive that things might slip back over and you might struggle again. Okay.
Yeah. I think it's, you know, because and we're talking to other people that they've managed to say that it can happen, and not to worry because it doesn't mean that you're going to go back to, you know, it's just maybe it can have little like hiccups.
Yeah. And I guess I know you've been completing this rating scale more regularly than when you're seeing us, and that you've described that's helped you monitor between good and bad days and see which areas of your mental well-being you've been struggling with a little bit more than others.
Yeah, definitely.
And you found that useful.
When I was finding it hard to sort of like concentrate on stuff, it would be hard to pinpoint, and that kind of doing that helped me sort of focus and find that, because if somebody had asked me maybe without, I would have probably like gone off and not really been able to, so it kind of helped me to look at certain things. I know, and like you said, it's not everything, but it's a help.
That's really good. I'm really pleased. Is there any other areas that you feel it's important for us to look at today?
Sometimes staff have concerns over not having enough time to complete SWEMWBS. However, this short interaction shows how using the tool effectively can facilitate meaningful discussion and allow the service user to reflect on any progress they've made. The film shows that through the framework of the 7 questions, the service user is given the opportunity to drill down and think about what is working well for her and why that might be. This again allows the service user to feel listened to, validated, and have her hard work and efforts acknowledged. Spending this time focusing more on strengths and successes could potentially have a great impact on a service user's self-esteem.